Hello, my name is Jānis Zaržeckis. My specialty is hand, plastic and reconstructive surgery. I'm living and residing and practicing in Riga, Latvia. And this time I would love to tell you some aspects regarding procedure as tummy tuck or abdominoplasty, which is surgery which can improve your outfit of belly. So because with the time, sometimes if somebody loses his weight or the belly could having deformities after giving the birth, it's too much skin, and if skin is loose and it sags down, and this leads to the thing that belly don't look nice. And you can, of course, to improve your outfit going to gym, but you can train your muscles, but you are unable to remove extra skin hanging down there. And the tummy tuck is a procedure how you can, it lets you to get rid of extra skin on the belly. So it's quite a big surgery, but it can give you really good improvement. In order to take the surgery, you got to come to consultation. First to see what is your likelihood of success, how much skin is, and to discuss during the consultation the complications what could occur. So the surgery itself, in my hands, takes approximately 1 hour, maybe 1.5 hours to cut off the extra skin. The first step is my anesthetist puts my patient in a nice sleep in operating theater. While the patient is sleeping, I do the big, long incision line across the belly, and I remove and get the loose of the skin and maybe some extra fat tissue as well. I pull it down, and all extra skin is excised. Regarding umbilicus, sometimes umbilicus I got to move it upwards and to put it in a proper place. Then sometimes if the inner fascia is loose, I do the plication of the inner fascia to give the better shape of the belly. And then the wounds are closed with a cosmetic suture, and the small drain tubes are applied. If the patient wakes up, you can see result right away. So the belly, the result is straightforward. You can see the straight belly, and there is no extra skin. But the patient got to stay at least 1 overnight in my private hospital, which is located in Ādaži. And the nurses will take best care of you. And then, the very next morning, I remove the drain tubes, and we apply the special belt around the belly, and patient can continue the further treatment on outpatient basis. The wound heals approximately in 10 days' time, and I suggest the calm, to be the calm. The patient can work, and some calm daily activities are allowed, but no gym, no big activities during the surgery. The patient is supposed to wear the belt for the 3 weeks' time. Normally in 3 weeks' time everything is healed well, and I allow my patients to go to gym and start regular activities, and then the life goes on. And that gives much better quality how the patient looks after this surgery. Regarding the complications, it's all complications according to the general anesthesia, some allergic reactions, but we have very good anesthesiological service, and my anesthetist will take the best care of you. And surgery itself can give the swellings and breathings, and then it goes away, it shrinks, and normally in 3 weeks' time, sometimes in 1 month, the patient looks well. Inflammation of scar is less than 1% in my hands. If it happens, if even the scar heals with wound heals with inflammation, it heals anyway. It just takes a little more patience from the patient's side and more care from my side, but 100% all wounds will heal anyway. There is one more complication regarding which is specific to abdominoplasties or tummy tuck surgery, and we call it seroma. That means if you can pretend the wall of belly and the skin, which is pulled above the muscles, sometimes in between the muscle layer and the skin, some lymphatic fluid might collect, and sometimes in significant amounts, and it's in the 1 up to 3 weeks time after the surgery. And then the patient sometimes comes back to my office and complains the belly was good, but now it looks a bit swollen and it feels like some liquid is inside. And there is 3 ways how to deal with this complication. If it's not much, it will absorb and we don't need to do anything. Sometimes if it bothers the patient, and if it's sometimes up to 1 liter, I do the small punction and I remove with a syringe the extra, this lymph what is collected, and then the patient is fine. And we hardly have to do it 1 more time. Basically it's 1 time is enough to get rid of this complication with a puncture. And another way how to it solves this problem is the patient, it could leak through the wound, and it might be a little bit scary to the patient, and then there is no need for puncture, but it looks that liquid goes out of the wound, and it might the patient might have a bit scary time, but it not affects the final result, and in all cases finally the patients got a good outfit, and the scar is located, they can hide it under the bikini line, and sometimes it can appear a bit reddish if it's hypertrophical scar, but normally in 1 year's time it appears white and just little visible. But it's impossible to do this surgery without the scars, so scars will remind the belly was there in a post-operative period. And that's basically it about the surgery of tummy tuck. If you're not happy how your tummy looks like, and then you're more than welcome. You can come contact our clinic for consultation, and if your likelihood of success appears good, I would be very pleased to help you out to do the tummy tuck surgery. And thank you very much for listening.